All right, hello everybody. Hopefully you can hear us in Employee Wellness. Welcome back to our Heart Smart program. This week, of course, we're joined by Rachel Carloni, who's one of our Gator Care pharmacists, actually our only Gator Care pharmacist, and is always gracious with her time and expertise to discuss the medication implications for heart disease and overall heart health. So Rachel's going to talk with you a lot about the different blood pressure medications, cholesterol medications, and all the other medications that are out there for preventing heart disease, but also more importantly, give you a chance to ask questions along the way, whether it was regarding co-payments or discount programs or formulary coverages, all those things that sometimes we don't think about until we're actually in front of an expert. So Rachel, all yours.
Thank you, John. So yeah, like John said, I'm a pharmacist. I work here in Jacksonville and then also with Gator Care. So as I go, if you guys have questions, feel free to throw them in the chat box. If you think of something later or something you just don't want to ask in front of everyone, my email is also, of course, on the screen. Feel free to email me with anything we talked about today or just any questions in general as well. All right. So what is heart disease? I know you guys have gone over this probably plenty of times with John before, but as just a brief review, remember that heart disease is what happens within the body when blood vessels become either damaged or diseased. So this is usually caused by substances such as fats and lipids that build up over time. These things cause plaques within our blood vessels. And over time, as those plaques get bigger and bigger, it can lead to blocked blood vessels so that blood can't flow through to our major organs, such as our heart or our brains, and causes things such as heart attacks or MIs or even strokes if it's affecting the brain. They can also cause blood clots that happen in a lot of different vessels within the body, but mainly going to be in the lower extremities or potentially the lungs as well. And then this is often called coronary artery disease or CAD. So a lot of these words are used fairly interchangeably, but they're usually kind of talking about the same disease state. So as I said before, heart disease can cause a lot of different problems within the body, including heart attacks and strokes and blood clots, as well as other things such as arrhythmias. So this is an abnormal heart rhythm. The most commonly known one is atrial fibrillation, or AFib is how it's normally referred to as well as heart failure, which is basically just the heart's inability to work as effectively as it should. All right, medications for heart disease. This could potentially be a very long topic, so we're going to try to keep it fairly simple today. Big things to remember for medications for heart disease is that there's a lot of different medications and that every person's medication regimen depends on how heart disease specifically affects their body. So you might have family members, friends, coworkers that have similar disease states as you, but you'll notice that everyone kind of has a slightly different medication regimen. There's not a correct regimen for everyone. It's very specialized based off of things like allergies, renal function, glucose, heart, presence of like heart failure, arrhythmias, things such as that. But it is important to remember that most patients are going to need more than one medication to help with the various ways that heart disease affects them. So commonly known medications are things that treat high blood pressure or hypertension, medications that can help prevent blood clots, and then also medications that help to treat high cholesterol. So we're going to start off by going into some medications for hypertension or high blood pressure. So the 5 main classes that we'll talk about are listed there on the screen for you all. So diuretics, or kind of more commonly known as water pills. And then we'll talk about ACE inhibitors as well as ARBs or ARBs. Those are 2 drug classes that are very similar. So we're going to keep those together. Next, we'll talk about beta blockers, which are medications used for blood pressure as well as for different arrhythmias within the heart. And then lastly, we'll talk about calcium channel blockers, which is another group of medications used for high blood pressure. All right, to start off with, so I said diuretics are also known as water pills, and that is because they help your body get rid of extra fluid. So they usually help your kidneys excrete more salt. Anytime our bodies are getting rid of more salt, water likes to follow, and by doing so, it helps to decrease blood pressure. So pretty common blood pressure medications, especially if someone is prone to have extra fluid. So patients with heart failure or someone that maybe just retains a little more fluid, these are very common medications. They are usually well tolerated, but big things to remember is that they can sometimes cause electrolyte changes just because your body is losing more fluid. So things like potassium and sodium are electrolytes that your physician will probably order labs relatively common or routinely to keep an eye on. And some people say that they get leg cramps taking these medications. Usually that is due to a little bit of dehydration. So a big thing to remember with these drugs, especially living in Florida, it's getting hot out right now, is to remember to drink plenty of fluids, especially water, to make sure that you're not getting dehydrated. So for all of these slides that we're going to go over medications, I've tried to include these charts that you see towards the bottom of the screen in, I guess, green or teal, that list some of the most commonly known medications in each class. So on the left-hand side, you'll see a column of brand name drugs. And then on the right-hand side, you'll see the generic name for the same medication. I think almost every drug that we're going to talk about today is available as a generic, which are much cheaper. But I wanted to include the brand name drugs as well, just for completeness sake. So the most commonly known drugs, like I said, are listed there. Hydrochlorothiazide, Lasix or furosemide, Bumex or bumetanide are all pretty commonly known and used. I think almost all these medications are also on the $4 list at either Walmart or Publix or some of the Winn-Dixie stores as well. All right, so moving on. So next we're going to talk about actually two types of blood pressure medication classes, but we're going to lump them into one just because they work very similarly. So this is going to be your ACE inhibitors as well as your ARBs or ARBs. So like I said, they work very similarly, but you should never be on one of each. It's one or the other. So both of these classes work by decreasing the effects of a hormone called angiotensin within your body. And what angiotensin is a hormone that causes your blood vessels to constrict or get smaller. And by doing that, angiotensin increases blood pressure. If we block the effects of angiotensin in the body, then it prevents this constriction and can help to alleviate some high blood pressure for patients. So they work really well at decreasing blood pressure. They work pretty quickly. And they've also been shown to prevent kidney damage for patients that are more predisposed to it, especially patients that have diabetes. So sometimes someone might not even have high blood pressure, but they may be on one of these drugs because of how well they work at preventing kidney disease. Common side effects, a big one, especially with the ACE inhibitors, is going to be a dry cough. Nothing really to be worried about, but definitely annoying for patients. They can also both cause increases in potassium levels. Nothing really to be concerned about, but your physician probably will order routine labs to be checked after you start one of these medications. And then both classes can cause allergic reactions. This is more common in African American patients and usually is difficulty breathing, mouth swelling, tongue swelling, things like that. So just be aware of the potential for that if you are on one of these drugs. So I listed them here to the right of the screen. The first three, the ones that end in PRIL, are going to be your ACE inhibitors. I think lisinopril is definitely the most commonly known one. And I believe it's free at Publix still. And then the last three that end in TAN are your ARBs or the ARBs. So a little bit newer class of drugs, but because they're so similar, we often group them together. All right, moving on, we'll next talk about beta blockers. These are really commonly known drugs for blood pressure, as well as medications that treat heart failure and arrhythmias or abnormal heart rhythms that can sometimes occur. So the way that beta blockers work is they decrease how fast the heart beats and how strongly it beats. So by doing this, it helps to lower blood pressure just because that heart is not beating out as strongly as it previously was. So your heart still works very effectively, but it just helps to decrease blood pressure. As I said before, they're used for a lot of different disease states, such as high blood pressure, arrhythmias, patients that have chest pain frequently, as well as they help to prevent heart attacks in patients that have already had one. So we call that secondary prevention. So it helps to prevent future heart attacks. They are most often well tolerated by patients. Really, like, side effects are not as common with some other blood pressure medications. Some patients do say, though, that they feel like their hands or feet can be a little cool after starting them. Usually goes away, and then some patients also complain of constipation as well. So at the bottom of the screen are our 4 most commonly known beta blockers. And you can see metoprolol is definitely the most common. So it comes in 2 formulations, which is Toprol XL, which is a long-acting medication just used once a day, or Lopressor, which is the same medication we've given twice a day. We also have Carvedilol, great for blood pressure, a little bit stronger than metoprolol, as well as Propranolol and Atenolol. So all pretty commonly known and all definitely generic as well, so fairly inexpensive. And then moving on, the last main class of drugs we're going to talk about are calcium channel blockers. So the way that these drugs work is they slow how fast calcium moves into the cells of the heart, and as well as the blood vessels. And by doing that, it helps to decrease the work of the heart and also decreases blood pressure. So a big thing to remember with calcium channel blockers is that it's not affecting how much calcium is in the body. So you don't need to take a calcium supplement or anything like that. It's just affecting how fast it's moving in and out of the cells. They're very similar to beta blockers in that they are used to treat a lot of different disease states in addition to high blood pressure, as well as arrhythmias and chest pain, also fairly common medications as well, and also pretty well tolerated. So common side effects can include dizziness. That's kind of true for any blood pressure medication, especially if it decreases your blood pressure too much. Swelling can be fairly common, especially with amlodipine or Norvasc, usually kind of within the lower extremities and the feet. If that is something that's happening, make sure to talk to your doctor. They can usually switch to a different medication, as well as a lower heart rate. And that most often happens with the second 2 listed, the diltiazem and verapamil. But the 4 calcium channel blockers that we use are listed at the bottom. Once again, they are all generic medications. Amlodipine, I believe, was free for a little bit at Winn-Dixie. I'm not sure if it still is. But amlodipine, nifedipine, diltiazem, and verapamil are the 4 most commonly known drugs here. All right. So other antihypertensives. So we can't include all blood pressure medications that we use just for sake of time, and I don't want to bore everyone to death. But these are some of the less commonly used blood pressure medications that you may see or may have even taken yourself. I didn't want to go over them too much, but just wanted to include them for completeness sake. So the first group are drugs called central agonists, and they work by decreasing blood pressure by working on receptors within the brain for the central nervous system. Clonidine is definitely the most commonly used or known medication in this group. Really good blood pressure medication. The only problem is that you have to take it either 2 to 3 times a day. So not the best in terms of quality of life. Just remember to take something that often. Very effective at decreasing blood pressure, as well as guanfacine. Kind of an older med that we don't use a lot, but you may see it or have taken it. The next group of drugs also work similarly, but they are alpha blockers, meaning that they work on receptors and help decrease blood pressure by relaxing blood vessels. So they are doxazosin, prazosin, and terazosin. They also work on the same receptors that they work on in blood vessels in the prostate. So for men that have an enlarged prostate or BPH, these are really commonly used drugs because they can help alleviate some of those symptoms. Much more often used for BPH than blood pressure, but if you are a patient that has both of those disease states, it can be easy to kind of treat 2 diseases with 1 drug, so you may see that. And then lastly, we'll talk about vasodilators. Work very similarly to the alpha blockers and help relax the blood vessels, causing vasodilation. The most commonly used drugs here are hydralazine, minoxidil, and isosorbide. I think hydralazine and isosorbide are going to be the more commonly known medications in this group. Hydralazine is also used 2 to 3 times a day. So we try to avoid if at all possible, but you may see as well. All right, so that's it for blood pressure meds. Like I said, I know that was a lot of info, so feel free to send away any questions that you have through the chat box, or if you feel more comfortable, for sure, you can email as well. So next we're going to talk about anticoagulants. And the big thing to remember is not every patient needs to be on an anticoagulant or even a blood pressure medication. So don't think just because we're talking about them today that it's something you have to be on. But anticoagulants are used because heart disease can lead to buildup of those substances such as plaques and fat within the body. And that can, within blood vessels, cause blockages as well as blood clots. So whenever you get the blood clot, you're at risk of blocking blood flow to vital organs, such as the brain, which can cause a stroke, or the heart, which can cause a heart attack. So anticoagulants work by preventing your body from making the substances that allow clots to form. They are oftentimes called blood thinners, which is a good way to remember them, but remember that they don't actually thin the blood. They're just kind of preventing things that would cause a clot. So blood should not be thinner. Some patients feel like they bleed a little bit more, and that's just because it takes your body a little bit longer to develop a clot. So they're usually used in patients who are at a high risk of a blood clot, or most often in patients that have already had one, especially in patients that have had like a DVT, so blood clot, usually in their legs, or one in their lungs, such as a pulmonary embolism. They're usually not used to prevent heart attacks, but they can sometimes be used in patients that have had more than 1 stroke while on another medication. So I included the most commonly known oral anticoagulants in the green box there. Warfarin, the first one, is definitely the oldest, and for a long time, unfortunately, was the only oral anticoagulant we really had. But within the past probably 12, 15 years, we've had 3 new agents released to the market. So they are all listed there. So Eliquis, Pradaxa, and Xarelto. Fairly used interchangeably. The big thing to remember here is that they are all brand, unfortunately, still. So fairly expensive, especially compared to all the generic medications we've been talking about so far. So if you are on one of these medications and are having trouble affording it, a big thing to remember is that most of the drug manufacturers for these medications will actually put coupons on their website You can just go to Google and type in the name of the drug and the word coupon, and it should pop up, and that will help you with some of your copay. All right. Next, we're going to talk about antiplatelet medications. These are similar to anticoagulants, but they help prevent clots from forming because they help prevent platelets from sticking together. So platelets are the main part of our blood that helps prevent or helps develop a clot whenever we have a cut or trauma, and by preventing the platelets from sticking together, it helps prevent any clots from forming. So aspirin is definitely going to be the most commonly known antiplatelet medication. Hopefully everyone's heard of aspirin. And it is very helpful to prevent things such as heart attacks, even if you've already had a heart attack or a stroke. So we'll sometimes use them in patients that are just high risk, or if you've already had an event, as secondary prevention. And then going back to the anticoagulant medications, someone asked if the 3 other medications listed, the new oral anticoagulants, require having levels drawn. They do not. So that's a big benefit to them over warfarin or Coumadin, is that they do not require monitoring. So going back to antiplatelets, so like I said, aspirin is definitely the most commonly known drug in this class, but we'll also see some newer antiplatelet medications such as Plavix or clopidogrel, Effient or Prasugrel, as well as Brilinta or Ticagrelor. Usually if you're going to be on one of the last 2, it's at the direction of cardiology, because they are a little bit stronger, but all of these medications work relatively the same way. And it's important to remember that you could be on an antiplatelet and an anticoagulant, but before anyone takes an aspirin, I would definitely check with your physician to make sure that they're aware that you're taking it. So that gets us to the next slide. So should I take an aspirin every day? And I think as pharmacists, this is a question we get all the time. You'll see a lot of kind of differing opinions in news or in guidelines regarding how beneficial aspirin is. And a lot of patients will benefit from taking an aspirin every day, but it's definitely something that you need to discuss with your physician, because not everyone is going to have a benefit from aspirin. The benefit in general is to help reduce the risk of heart attacks and strokes, but they are drugs that are associated with the potential for things such as bleeding, GI ulcers, things such as that. So your physician should really kind of go through your specific medical history and your risk and weigh the benefit of an aspirin versus the risk of things such as bleeding. The other big thing with aspirin is make sure that if you are recommended to take an aspirin every day, that you clarify what dose it should be. So almost every patient that is on a daily aspirin should just be taking an 81 milligram tablet every day. That's usually called like a baby aspirin. And it's called a baby aspirin, not because you should give it to babies. No children should ever get aspirin, but because it's a smaller dose. So the 2 doses that are commonly sold in stores in the US are either 81 milligrams daily or the 325 milligram strength. 325 milligram strength, we usually use if someone is having an acute stroke or an acute event. But besides that, most patients should not be on the higher dose of 325 milligrams every day, with very few exceptions. So if you are someone that has aspirin at home, you don't know what dose you're taking, should just say on the bottle if you check when you get home this evening. All right, and lastly, we're going to talk about medications that help lower cholesterol within the body. So cholesterol is usually one of the substances that leads to all of these problems that heart disease cause. So by lowering cholesterol, it helps to prevent those plaques from building up within blood vessels. By having blood vessels that don't have that, then it decreases our risk of things, once again, such as heart attacks and strokes. So most cholesterol medications help to decrease bad cholesterol, which is LDL, while increasing the good cholesterol, which is HDL within our body. And the big thing to remember is, unfortunately, you still have to follow a healthy diet if you're on one of these meds. So you don't get a pass to eat whatever you want just because you're on one. They're going to work best if you use them in combination with your high fiber, lots of fruits and veggies, lean protein diet. So we'll start by talking about statins. These are definitely the most commonly known cholesterol medications, and they work by decreasing how much cholesterol is produced in the body. So they decrease the bad LDL and increase the good HDL. And they've been shown in lots of different studies to help prevent cardiovascular events and improve survival in patients with heart disease. So not only do they have a benefit in preventing someone from having a stroke or a heart attack, but afterwards they help prolong how long patients live. So the four most commonly known statins are listed below. There's a few more, but just so I didn't overwhelm everyone, I just included those. So we have Lipitor or atorvastatin, Crestor or rosuvastatin, as well as Zocor, simvastatin, and pravastatin. So all used fairly commonly. Sometimes patients will have side effects with one. Usually that tends to be lower leg cramps or muscle pain. If that is the case, talk to your physician. It's possible that if they just switch to another agent, that it will not cause the same side effects. But really important drugs to be taking and have tons and tons of benefits. And then other cholesterol lowering meds, these are not used as often, mainly because statins are so effective that if there is any reason to have someone on a cholesterol lowering medication, we try to keep them on a statin. So the drugs listed below are really for the exception to the rule if you cannot take a statin. So Zetia is a medication that's relatively newer. It helps prevent the absorption of cholesterol, as well as cholestyramine or cholestyramine. They also help to get rid of extra cholesterol within the body. Fenofibrate, these are older medications, but they help to decrease levels of triglycerides specifically. Triglycerides are usually the breakdown product of carbohydrates. And they also help to increase HDL, or that good cholesterol. And then lastly, niacin is a medication that's available by prescription as well as over the counter. And this drug works by decreasing how much cholesterol is made within the liver and therefore in the body. So you might see someone on multiple of these medications. And it just kind of depends on their medical history, as well as what their lipid panel looks like and what specifically is elevated. But by far, the statins are going to be the most effective and the most widely used drugs. All right, so that's it. I know we went through a lot of medications. So like I said, feel free to send any questions that you guys may have. And then just as kind of a general wrap up, we tell patients this for every disease state, but a big thing is trying to remember to take all of your medications as prescribed every day. So there's a lot of different ways you can do this. We always recommend pill boxes. There's even some really cool new pill boxes that have alarms. If you haven't opened it in a certain period of time, the alarm will go off and remind you to take your medications. We recommend cell phone reminders as well if you are someone that forgets to take your medications every day. Remember, a lot of pharmacies, especially chain pharmacies, will do automatic refills. That way you don't have to remember to call every month. They'll just go ahead and get it ready for you and call you when it's ready. And all of these are important because even missing a few doses of medications can have an impact on your health. For some of the blood pressure meds that we talked about, actually missing a dose can cause your blood pressure to shoot up higher than it probably was before, causing something called rebound hypertension. So even if you feel like it's just a dose here or there, it can have a big impact. And then remember to talk to your doctor, but if you feel like you can't get a hold of your doctor, you just have a lot of questions, that's what pharmacists are here for. Like I said, I'm here, or your pharmacist at whatever retail pharmacy that you frequent. And a big thing to remember is ask them, should I be taking anything else that I'm not? What about drug interactions? And do you have any other recommendations about lifestyle changes, supplements, vitamins, things such as that? And then lastly, if you are someone that has Gator Care, I think most people are, but if you are not, your own insurance should have something similar. But if you do have Gator Care, there is a Gator Care website. It's gatorcare.org, which is pretty easy to remember. And then towards the right-hand side of the screen, there's a pharmacy tab. When you click on that, there's a pharmacy lookup tool that you can use, and you can type in the name of any drug into that tool, and it will tell you whether or not it's covered by your insurance. And then also if it's a preferred or non-preferred drug. Or if it's easier, on the back of your blue card that you should get once a year, there should be a 1-800 number that you can call as well, and they can help you in the call center, try to figure out if something's covered or what might be a cheaper alternative. So that's all I have. Like I said, feel free to reach out if you guys have any questions, comments, concerns, or if it's about anything that we talked about today or any of your other medications. But that is all I have for you guys.
All right, thank you, Rachel. As always, we will send out the copies of these slides to everyone that's registered for this program. And of course, if you joined us a little bit later, we're going to have a recording of this also posted on our website and uploaded to our YouTube channel for those individuals that are in Gainesville. So again, appreciate your time and attention to this matter, and you will also get a little attendance quiz too. So we ask that you fill that out in the email that goes out, and we look forward to seeing you again next week as we talk about handling stress, which I know we all have in our lives, and we're going to talk about some strategies to not really manage it as much as make it more of our ally in our day-to-day lives. We've got some creative things that we can do to help make us stronger. So thanks a lot.